I'm Surbi Bhatnagar. I am a postdoc at Cincinnati Children's Hospital. I am going to be talking about identifying specific mental health concerns, phenotypes, doing NLP extraction from clinical notes in the context of cerebral palsy. So, cerebral palsy is a neurological condition that affects movement and muscle coordination. It is fairly common among childhood disabilities. If it's diagnosed early and the right treatment is given, it has significantly better health outcomes. We also know that it is comorbid with developmental and intellectual disabilities. So it made us wonder, does that affect their speech, communication, in terms of treatment? Could that also affect the diagnosis and care of other conditions? We were motivated by this and we wanted to evaluate what we could do using our data. So we have about 500,000 kids with 50 million notes. About 10,000 of them have cerebral palsy. And we wanted to explore more. So I've listed all the research goals that we had in mind. So perform data mining, analysis from the identified features, identify risk factors, any specific novel insights that we can find, leverage all the information that we see in notes that are typically missed by EHR structured data. And we used Johnston Labs Healthcare NLP library for this. We used a couple of their models to extract all the extra signal that we could. And then we performed modeling so that we could detect cerebral palsy early in younger kids, and then also identify specific disease and treatment care patterns. So I will start with what we did with the EHR. So the EHR was transformed to an OMOP data lake. For all the structured data, we did a lot of processing and QC. We extracted all the structured data in tables and then transformed them further according to expert domain knowledge. We have a lot of visit level information like conditions, procedures, medications. They all have their own expert ontologies. We have a lot of metadata for each visit. We also have a lot of person level data about the person demographics, about their family history, about anything else that could be there that is static throughout a person's length of care. And then the EHR also comprises of clinical notes that are unstructured, free text. They have a lot of information from their every visit, every progress, every point of progress that they've made in their care. And we wanted to leverage that and use that to understand more. So the next step was using specifically those clinical notes, extracting any clinical entities that we could, mapping them to, again, the known expert ontologies like ICD-10, SNOMED. We also wanted to see if we could identify any social stressors, any social determinants of health that could adversely affect care or treatment. And we compiled all of this, cleaned all of this, and then combined them. These are all the clinical entities that we extracted from the notes. So these are the categories. We got disease types, we got medications, we got labs, we got the stressors and social determinants. So I think it was about 80 or 90 plus entities that we extracted, then resolved, and then further cleaned up into our desired categories. So this is the combined feature matrix. The details in green are for the structured side of the EHR, and the pink is the NLP extracted features. So we can think of it as a 3D matrix in the end, where the features are columns, the people are rows, and then there is a flexible time axis for the longitudinal data, how it changes over time. And that's very important to see, especially when the disease is changing, the recommended care might change, the person is aging. So we want to see how that is progressing over time too. So we extracted all of these features, combined them, and then we rolled them up to higher level concepts that were useful for our modeling. And we did further analytics and modeling using those. We also want to make sure that the controls we compare cerebral palsy kids to are appropriate. So we wanted to compare them to two sets of controls. One, children with similar conditions that may be chronic and have typically similar visit patterns. And then second, that are typically developing controls with no known chronic condition and are relatively typical in terms of their trajectory. So we performed matching and then compared cerebral palsy to both of these controls. Our first modeling goal was early detection. So we were able to identify specific features that were showing up during a person's care right before they're officially diagnosed with cerebral palsy. We wanted to use those features, and these are features that we found in their phenotype, so in their symptoms, in specific types of diagnoses that they had, in medications or any other procedures that they had. They typically occurred in the months prior to an official CP diagnosis. So we wanted to use those features and learn them so that if we have a person who does not have any known diagnosis, we can predict on them and see if they're potentially having any cerebral palsy symptoms. So we were able to leverage these features, and we were able to identify people that fit the same pattern. So using a test train split, we were able to get an accuracy, AUC of 0.84 using XGBoost. We did notice that this accuracy significantly improved when we added NLP extracted features, which makes perfect sense because we have traits there that are not exactly in the structured data, but can be very useful in trying to identify if a person might be developing or should be identified with this specific condition. So we were very happy to see that we got a jump using NLP extracted features. And we tried multiple different methods, and we saw that the XGBoost model performed the best. And the potential health outcome here is that we can maybe use this in a clinical setting, and if we identify people earlier, they can be referred to their neuro OT PT for diagnosis and early treatment and care, which will help their overall health outcomes significantly. Another goal that we wanted to focus on was trying to see if there are any mental health conditions that are missed or that are underdiagnosed or overrepresented in cerebral palsy kids. So we found that there were some that were higher than what we see in typical kids. For example, anxiety. We saw that anxiety was observed at a higher rate in cerebral palsy kids, along with stress, some trauma, OCD. We also noticed that depression and suicidal ideation was diagnosed at much lower rates in CP. And this is where we wanted to understand what was happening. It raised questions like, is this underdiagnosed? Do we need better psychological instruments that are specialized for cerebral palsy kids that can better identify mental health conditions? And this would be an interesting finding here, and it also raised a lot of important questions. We also saw that there were differences by their gross motor function classification system. So the classification system can classify the different can classify the type of severity for their gross motor functionality. So we did see that there were significant differences across, and for some of the more severe function loss, we saw that there were some mental health conditions that were worse and some mental health conditions that were less represented. So again, we wanted to know what's happening here. What is the cause, and what could we be missing? Can these be explained by the differences in their phenotypic presentations, that there might be lack of communication, there might be some lack of expression? So this is an important finding, and we wanted to know more. So next, we wanted to identify these specific underlying mechanisms and associations. We used all the features that were extracted using NLP. We also wanted to connect them to the structured data. We wanted to connect external biological sources and mappings and ontologies that also are related to this, so that we can identify what the known association is. For example, cerebral palsy and epilepsy. Are there differences in etiology? Is it because different parts of the brain are affected? Can we identify the specific etiology that is presented for a specific person? Is it changing over time? And now that we have those features, we were able to answer some of these questions, but we're still understanding, and we're beginning to connect how this is happening. So the improved concept linking can help us understand these important differences. It will also lead to better data discovery and improving the therapeutic approaches. So can this be personalized, given that this is the etiology of this case? And overall, this will improve health outcomes. So using the extracted features and the structured data, using all the external biological systems that we have access to, and the mappings and ontologies, we are able to link and try to understand these associations. We are still working on this, but this is helping us understand the association and causality better for cerebral palsy. So this is just an example, and it has a lot of important applications. So once we have these, we are also able to identify clusters for different subgroups with CB. This also helps us identify the different types, the underlying structure we're seeing in the different types of CP. There are different types of presentations, and to identify which treatment is working for what type of presentation, and if we can personalize that treatment by identifying similar cases that it worked for. So this is an example of the top differential features that we found, and we can see that there was a specific treatment that happened, And there's that increased cluster, the highlighted cluster of increased activity. And over time, that increase is able to differentiate the cerebral palsy kids from other cerebral palsy cases and then from also other controls. And this was an interesting finding. We're exploring the specific features and again, the associations and any other inferences we can gain from this. So all of this is helping us understand cerebral palsy a lot better. It is also helping us model the cases that we have and then detect cerebral palsy earlier, and then also improve the understanding of their disease etiology, their causality mechanisms. It can help us identify better therapeutic approaches that are personalized, that can be better treatment for them. And we are working towards submitting our findings with the early detection model, as well as the mental health conditions that we identified. We are working, and the modeling of the disease trajectory is still in progress. And we are working towards understanding and connecting those care patterns and those treatment patterns better. So thank you, and please let me know if you have any questions.
This concludes today's sessions. I'd like to extend my appreciation to the speakers for their comprehensive discussions on NLP's role in healthcare and life science. We've seen firsthand the potential and the challenges from improving healthcare record analysis to aiding in early cancer detection and refining treatment plans. We continue tomorrow at noon for the third day of the NLP Summit, diving into AI applications in sectors like finance, retail, manufacturing, and advertising. See you tomorrow. Enjoy the rest of your day.